Welcome all to the FSHD Society radio show. This is a hot off the press episode, and we got some late breaking news, more or less, more pressing news, to be honest with you, that we need to kind of address and talk about. We have some great guests to bring this to the forefront of the FSHD Society hot off the press episode. So without any further ado, let's introduce Allie and Kristin into the show. Welcome, guys. Thanks for being here. I don't know who wants to go first, just to kind of give a little bit of a who you are and why you're here, kind of a intro to our audience that's excited to hear what we have to talk about. But I kind of wanted to start at least on that first step of introducing yourselves.
I'll go ahead and go first. My name is Allie Roets. I'm the director of the early onset chapter, and I have a son who is 17 years old who has early onset FSHD.
And I'm Kristin Zwikau, and I am heading up the New England chapter, and I assist Allie on the early onset chapter as well. And I have a daughter who is 11 that has FSHD, and in both our cases, our kids are the only ones in the family with FSHD.
Interesting. And I know we've talked about that, the early onset chapter, and the push to kind of make that a little more in the front part of people's thoughts about this disease, not just how, even though on average and all that, it seems to affect people later or manifest itself later, but there's a large, in my opinion, population of people that it happens a lot earlier and going down the line even younger, like you guys said, 11 years old and 17 years old. So I'm glad that we've continually talked about it, but this is also talking about it from a different perspective. There's a big study going on right now, the M.O.V.E study, and we're kind of calling out people to volunteer and be a part of that study. And that's why you both are here. Talk a little bit about that. Why is that important, and how does it relate to early onset?
So first of all, like you mentioned, the early onset population isn't very well represented or very well visible in the community. A lot of people, the literature on it's kind of lagging to think that mostly FSHD occurs later in life, and that's not always the case. And oftentimes when it occurs early onset, which they define as shoulder weakness before the age of 10, there's a lot of patients out there and children that aren't really on the radar, so to speak. They're not involved in any kind of clinical trials. They're not registered with U.of.R. registry. So they're sort of an invisible population. So what we want to do is get these kids registered in the U.of.R. registry so that we know that they're out there. And secondly, get them and other FSHD patients enrolled in the M.O.V.E study. And the M.O.V.E study is vitally important for the whole community, but especially for pediatrics because they're so underrepresented. And Kristin, you want to talk a little bit more about natural history and the importance of the M.O.V.E study as it pertains to the FDA drug approval?
Yeah, and how it relates to drug, yeah.
Yeah, well, so pharmaceuticals cannot do a the clinical trial process is about creating endpoints. And if they don't have information about how the disease progresses in multitudes of different people at different ages, different geos, they don't have the ability to create clinical endpoints that are meaningful that the FDA will see as reasonable to show that the drug is effective. And the M.O.V.E study in natural history studies are set up to track progression, to track what's going on within a multitude of different patients from different age groups, different geographies, different nationalities, so that they can show that what happens in each area, they can show that progression to create these endpoints. We watched it with Fulcrum. They had a clinical endpoint on the first round of clinical trials, the clinical trial 2. They didn't meet that endpoint. They redefined it to come through with clinical 3s, and now it's the reachable workspace. That's a definition of what it means to have a clinical endpoint. Right now, for pediatrics, because there's been no natural history study done on them, we all have the data. We all know that we bring our kids to the doctors more than the adults go to the doctors, but it's not in a uniform way that pharmaceuticals can use to say that all of the data was collected the exact same way, so we can show the trends and the progressions through data of this is what's happening, and this is why we know this is a solid endpoint to use when it comes to pediatrics. There's been nothing collected from a uniform standpoint on pediatrics. There's also not been enough collected on adults. And so the M.O.V.E study is being put into place to combat that gap that we have right now. It's a big gap that the FSHD community has for pharmaceuticals to push these clinical trials forward. If they don't have the data of what's happening inside patients over the course of many different age groups, many different geos, many different nationalities, they can't create the endpoints they need that will make effective drugs that will get through the finish line for the FDA.
So we're basically falling short of getting people involved in the M.O.V.E study. I think they're
Overall.
overall.
Not just pediatrics, but
Yeah,
adults
not just
too.
pediatric, because I think they were looking at 400 plus participants in the M.O.V.E study. And
I thought it was a little less. It could be that, but I thought it was a little less.
Okay.
But I know that as of last month, there were 50% where they needed to be overall. And we need about, I would say they're looking for around 100 plus kids, and we're at 15. So
15
falling way short on the kids. And
Wow.
just to clarify, the clinical trial and the data collection doesn't start until you have that last patient enrolled. So even if you enroll today and it takes us 5 years to get up to those 200 or 100 patients, however many you need, that date on that last patient being enrolled, that's when the time clock starts. So the speed to enroll in clinical trials, whether it's for a drug or whether it's for natural history, it's so important, because the longer it takes the community to enroll in these clinical trials, the further out the results come.
So yeah, so the starting gun doesn't go off on these studies, or I should say the trials, until it's all full. You're saying we have to hit those numbers first before we can say, okay, now we begin.
Right. It's still useful. Like, I have my daughter in the M.O.V.E study, and it's still useful to get involved as soon as you can. But we as a community need to pull together, and we need to get it done. Same thing with Fulcrum. They're not fully enrolled right now. It's a 12-month study, but that doesn't start until patient 250 is dosed. So when that last patient is admitted into the trial and has got the medication, that's when their data starts. Even though the patients who are enrolling today and getting accepted, they're starting the medication today, but it doesn't, and they're being tracked. Still very important to track that whole time. But the real data starts when every patient is enrolled.
So what do you think the hesitation is for people either not getting involved, or if they have a child with FSHD?
Allie, what do you think?
Yeah.
So I think part of it's just the unknown, just not knowing what you're getting into. And, I think everybody hesitates, especially when it's with their child, even when themselves, they have to travel and they have to put in some effort to it. And that's what I want to talk to you a little bit about as well. So when I enrolled, I live in Arizona. So there's 12 sites with the CTRN. They're doing the M.O.V.E study. It's very easy to get the ball rolling. So you just go onto clinicaltrials.gov, and then you look for a study. You type in FSHD, and then the M.O.V.E study actually is the first one that will come up. And you just click on that, and it'll go through everything that you're going to be tested on, and then all the sites. And so it will give you all 12 sites, and then it will give you an email or a phone number. Basically, how I enrolled, I just said, okay, I'm in Arizona, I can go to California or Utah. I picked Utah. I got in contact with them. They emailed me back right away. They wanted me to send a little bit of paperwork, not a lot, and they scheduled me. It was very easy to do. I thought that it would be a lot more complicated. I had to, put my son in the van and drive him to Utah, but we spent a couple days there and came back. But it was a very easy process, and they were very responsive. And I think just taking that first step, honestly, sometimes is the hardest, but I would encourage everybody to just do it. It's very simple.
I had the same experience. We went to Rochester. We live in Boston. We flew to Rochester. They had it all organized. It was seamless. We got in at 9 a.m. We were done by noon, and we were back on a flight to Boston. And they organized everything for me. It was very simple, very easy, and they made it very fun for my 11-year-old. And they didn't pressure her into anything she didn't want to do. They offered her blood work. She said no. They're like, then we don't have to take it. And then she went and played a bunch of fun games with the physical therapist. She saw the doctors, and then we were out the door.
And
So
And honestly,
go ahead.
just one more thing. Honestly, I think this disease is so sort of tricky because it's slow yet it's fast, right? So when my son was the first indication he ever had was that he had hearing loss when he was 3, and I thought, well, it had nothing to do with muscular dystrophy. And then he was like in an AFO and then another AFO and then surgery, and then 10 years later, just in a span of 10 years, he went from just having a little bit of hearing loss to not being able to stand or walk, having to use a wheelchair. So you think it kind of creeps along. So you're thinking, oh, he's going to kind of stay here. He's going to be fine. So maybe you're not thinking that it's going to get much worse. So maybe I don't need to get involved. But cautionary tale, right? Don't delay. The quicker we get these things in place and the quicker we get in these trials, the sooner we're going to stop this disease before it progresses that rapidly. Yep. So you need to get on it and not be complacent and, oh yeah, he might have a limp or he can't lift his arms or this or that. It's a progressive disease. They will get worse. So we all need to come together and eradicate this disease, and we need natural history to do it.
But Allie, remember, some also don't want to get their children diagnosed, even though it's in the family. And you don't have, the child does not have to be diagnosed with FSHD to go into the M.O.V.E study. And as long as there's a parent or someone in the family that has FSHD and it's a parent, then they can take everyone in the family. So it doesn't need to be, they just need to show a sign here or there, but it doesn't need to be conclusive that they have it. It's still just data that they can track. And then down the road, if it's proven that the child has it or not, it's data that can be brought in or not. But it's better to err on the side of just get your child enrolled while you're enrolling and make it a family thing. The other thing is that I will tell you, it makes, I know Caitlin and Sam both felt the same way, like they're doing something. It gives your kid a chance to feel like they have control over an uncontrollable situation. They're actually part of the solution. And that was huge for Kate in feeling like, wow, I'm in a clinical trial. And that's really kind of cool because I'm going to be part of the solution when this thing is solved. And I think that as parents, we should think about giving them some sort of control and voice in this whole process.
Right. And just because a parent progresses at a certain rate doesn't necessarily mean that their kid is or their grandkid will progress at that rate.
The other misnomer that I've heard out there is that if you enroll in the M.O.V.E study, you cannot enroll in any other study. And that is not true. You can opt out at any time. So if you enroll and then Fulcrum comes along and says, nope, you're perfect, you can say, no more M.O.V.E study, I'm going over here. And they're fine with that. Or if you're like, I don't want to do the travel anymore once a year, opt out, But, we've all got to step up as a community and be part of this solution and as quickly as possible, because the longer we take as a community to get things like the M.O.V.E study filled or get things like Fulcrum filled, the longer it's going to take before we actually have a solution to this.
So basically, though, then this is being completely unrepresented by a lot of different groups that have FSHD, not just young people. We're talking about different races, ethnic backgrounds, and whatnot. I mean, overall, this is really lagging. Mm-hmm. So we talked a lot about having, obviously, the early onset, young people being involved, parents getting involved to get their kids involved. And that's probably overcoming some fear. I think you guys have tackled that very well, of how to kind of push through that. I love, Kristin, how you said, well, make it a family thing, kind of correlate it with we're doing this together. And it's also part of history. This is the largest ever natural history study. So there's that aspect of it. Do you want to be, what side of history do you want to be on? The part that pushes us through, or did you just stand on the sidelines?
Yep.
For adults that maybe are on the sideline and maybe they really haven't come out with, saying they have FSHD. I think that there might be some of that reluctance here too, to even get involved with this study. But you mentioned that you don't have to have necessarily a test saying you have this or a diagnosis. Is that accurate? Did I understand that?
There needs to be a diagnosis in the family.
Okay, just in the family.
Just in the family, not in the actual, and then in the child, there needs to be some sort of clinical there's a possibility here.
Okay.
So I think for the M.O.V.E study, you have to have at least a clinical diagnosis. For U of R, you don't have to at all, just as long as there's a family connection. But I think at least a clinical trial, but you don't have to have a blood diagnosis.
Right. Like a
Like an
DNA.
Nothing on the books.
DNA,
The
right, nothing on the books.
child's diagnosis does not need to be on the books, but it needs to be like there's an indication that there's a possibility here.
Right.
And then when it comes to, because I'm just thinking in my mind, if I was the person listening to this, what is the reluctance? What are my hurdles? Is it travel? Is it the commitment? You talked about the travel, how it's easy when you arrive, going through the process, how to find it. So we're starting to chip away at what would be barriers. But one of them that came up was maybe like commitment. How often do you have to do this or go through this M.O.V.E study? Is it a one-time and you're out? Is it a progressive thing over time? How often do people have to participate or visit one of these sites?
Well, it's once a year minimally. If you can go twice, that's even better. But once a year minimally, I mean, it's a progressive disease. So that's what they're trying to measure. So you've got to see people over a course of time. Otherwise, there's no data to collect. So it is over the course of time. And you can tie it into your visit if you wanted to make one of the doctors at one of these sites your primary physician for FSHD. It's tied into the doctor visit that you go to yearly anyways. I don't know if adults do, but I know that we do as parents. You're going more than once a year typically. So it's tied into that visit. So it's not an added burden from that perspective. It's just instead of going to your local hospital, you're going to wherever the site hospital is that's closest to your home.
True, because we need baseline anyway and see our progression anyhow. So this is kind of killing two birds with one stone, so to speak. Yeah, makes sense.
Right. So again, I think the reluctance is just getting started. And then the travel, there is some expense with travel and just time going. And then again, I think just being complacent. But now's not the time to be complacent. They have all of these pharmaceutical companies that are itching to get this drug out, and they just need the natural history to be able to make a good trial. So my opinion is every person who has FSHD or has a child with FSHD, unless they're just physically incapable of enrolling in the M.O.V.E study, should seriously consider it and get there, because this is going to help us all just advance the treatment for this. And it's not invasive at all. A blood draw is about as invasive as it is. So just taking out the time and making it a priority and just doing it, it's going to help the entire community and yourself, your kids, your grandkids. Let's get rid of this disease and just eradicate it. But we have to have natural history, and it's just complicated. I didn't know what natural history was 8 months ago, until somebody sat down and explained it to me. So now I know, like, you have to know how the disease progresses before they can make a good trial, like Kristin said.
Right. And we are only in drug development. They're only at 1.0, right? Like, this is not the silver bullet. This is not going to wipe it out. This is just the beginning stages. This is, fulcrum's not going to stop it forever. It's not the end all be all. That's why the pharmaceuticals haven't stopped working. So it's the more we can get involved, the more we can get into the registry, the more we can get into the M.O.V.E study, the more we show the community is activated, the more interested pharmaceutical is in working with us and making sure that we do get the silver bullet someday.
So with this M.O.V.E study then, so this is like shared data then, right? It's not just the fulcrum. We know you've talked about that, but it's other. Oh,
yeah, it's for all of them.
Trials. Okay. Yeah. That means even more motivation, right?
Yeah, this is not fulcrum at all. Yeah. This is University of Rochester and the M.O.V.E study. University of Rochester has the registry. That's one piece. That's nothing. That's filling out some paperwork just to know that you exist so that you'll get a call when clinical trials happen. But the M.O.V.E study that's for the industry. That's for everybody.
Right. Excellent. I feel anxious, to be honest with you. I feel anxious that this has to be done, and that I know we've talked about it. I know it was at the Connect conference talked about, and it just doesn't feel like there's enough. And I know this is just another portion, another piece. So then what is the next step if this is lit a fire under certain people to get going in it? Where should they go? How do they get started?
So like I said before, they could go to the FSHD Society webpage and find one of the 12 CTRNs, go to clinicaltrials.gov, clinicaltrials, plural.gov, type in FSHD. When you type it in, you hit enter. The M.O.V.E study will be at the top of the trial. Click that. It will tell you everything you'll have to go through for the trial. And then it has all of the locations that are participating in the M.O.V.E study. Go there, make contact with someone, call them on the phone, email them. They'll walk you through everything and they'll get you going. And then you just have to commit to going, either flying or driving, or some people have these centers very close to them and other people will have to travel a bit. But it's vitally important to get them in the trial, everybody in this natural history trial, so that they know how the disease progresses, so they know if the medicine that they're developing is working. Mm-hmm. If they don't know how the disease progresses, they don't know if it's the interventions and the treatments are working. I mean, that makes sense, right? If you don't know what the baseline is, you don't know if the drug is working. For any of the drugs that are out there, any of them, they all need it.
Right. And this is independent. It's not FSHD society. It's not any society. This is independence. This is a study that is being done by the doctors in the FSHD world.
Right.
And the researchers from Friends of FSH, Solve FSH, all those, they all have access to this data as well.
Yes. Yeah. And it's all out there. I mean, you mentioned the website where to find it. That clinicaltrials.gov is not an FSHD society site, but all these people are probably trying to network within their groups to get people involved, to know where to go. It has to be a community push. There's no question about that. So I'm glad that you mentioned that. It's a valid point, that we need everybody, if you're involved with the FSHD society or not, as long as you're affected by FSHD. To me, I think I'm with Allie. We should all get involved no matter what. So before we let you go, make sure we didn't leave anything out. The whole message across to everybody. What is that last thing that you want to say to make sure we hit it all?
So the one thing I want to say about pediatrics in particular is there are no clinical trials other than the M.O.V.E study that pediatrics can be involved in. There's no non-ambulatory clinical trials that people can be involved in. If you're non-ambulatory, if you're pediatric, it doesn't matter. You can all get involved in the M.O.V.E study. And specifically for pediatrics, we need this natural history vitally so that when a treatment comes, our kids aren't years behind getting a treatment than the adults. What sets me bolt upright in bed at night is if you would have a treatment out there and then you take your kid to the pediatrician and go, hey, I'm all excited. There's this treatment for FSHD. Can I get it? And they're like, oh, no, it's not approved for someone under 18 or someone under 12. And you have to watch your kid deteriorate because there wasn't enough natural history on the kids. And now we have to wait 5-6 more years. Like I said, 10 years for an early onset severe patient is life altering. Wow. So we have to get the kids in there so that they can get in the trial, so they can get treatments along with the adults.
Mm-hmm.
Right. And we don't need as many kids as the adults. So if we can even get the study to 50 kids, we will have enough data to help get the pharmaceuticals started. And they're all willing right now. That's the thing. We don't have the data to offer them, but they are willing to look at kids for clinical trials because they also understand and think that the kids are progressing faster. They can see the drugs working in the children quicker than they can in an adult. They want this group of patients, but there's no data on it. They cannot create clinical endpoints because we do not have any uniform information on the children.
Wow.
And let me say one more thing that a researcher said to me once, and because sometimes I think parents are hesitant to take their child in because they're not that severe, like they're not showing a lot of signs. They said those are the kids we want because they might be the key to unlock what triggers it. Right? If they're not very severe, but that they have and they've been clinically diagnosed and they get into this trial, what makes it? Because we'll go through periods where it progresses very rapidly. If they have that child or even an adult in the clinical trial, when that happens, that might be the key to say what triggered that DOX4 to come out, more rapidly or make the progression more severe all of a sudden. That might be the key. So don't hold back just because you don't think you're severe enough or you don't think your child is severe enough. We need everybody.
Everybody.
Yeah.
Well, thank you both for joining us today, talking about this topic. It is hot, definitely, as our episode kind of says, right? Hot off the press. I mean, we need people to get activated with this immediately. There's no need to wait any longer. Now is the time. It is upon us to get this data going. So thank you very much, Allie and Kristin, for being here, spreading the word, and putting it in a way that we all can understand at that proper level. You know, I love scientists and all, but I am not a scientist. I like to talk to real people in the trenches, and thank you for doing that with us today.
Thank you.
Thank you for having us, Tim.